Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. With the CareCredit credit card, you can get the dental work you want or need now. CareCredit is accepted at hundreds of thousands of locations nationwide for preventative, restorative, and cosmetic dentistry. Today we're in Los Angeles, California with Dr. Daniel Naysan. Dr. Naysan is a member of the American Dental Association and specializes in aesthetic smile design. He practices cosmetic, general, and emergency dentistry in the heart of Beverly Hills. Today we're talking about dental implants and bone grafting. Thank you so much for joining us today, doctor.
Thank you for having me.
So what exactly is a dental implant?
So a dental implant is made up of a titanium screw that goes inside of your jawbone and is used to treat missing teeth.
And when or why would someone need a dental implant?
So when you lose a tooth, unfortunately, to fracture, crack, or you have an infection, you lose a tooth, implants are a great option at restoring that tooth.
Is this something that happens common? It sounds like there's a lot of different scenarios that someone might have to replace a tooth.
It's not common, but it does happen.
What are the different types of dental implants? I know you kind of just mentioned there's a few different ones. If you could just maybe elaborate more on that and what exactly each one of is made of.
So there are a lot of different types of companies, brands from all around the world. Most of them are made out of titanium.
Okay.
However, there are some that are made out of a porcelain zirconia material.
And how would you know, or how does one know which one to use when?
So they can both be used for the same situations. A lot of people these days want to stay away from metal, so they're opting in for the zirconia implants.
So implants, it sounds like it might be painful or scary. How painful, how invasive of a procedure is this?
It's actually not painful at all. With local, you can get it done. There might be a little bit of pressure, but no pain at all.
Can you walk us through exactly what happens in a dental implant?
So right now, the great thing is we can do a lot of our procedures with a CT guided stent.
Okay.
So what that is a CT scan can determine, based on the location of where it's best to place the implant, make a stent, which is something that goes inside that person's mouth. And we can basically drill a hole into the jawbone and integrate that implant into the jaw. And that goes in, and it needs to be there for about 4 months until it integrates. And then you could put the crown that goes over that implant.
So how long does this whole procedure take from start to finish exactly?
So the first visit, which is the actual implant, usually can be done in less than half an hour.
Okay.
You wait 4 months, and then you come back, and it's a 2-visit procedure. So you come in, you basically uncover the implant, put something in it to take an impression. That impression is sent out to a lab, and lab makes the crown. It comes back, and we put the crown into the person's mouth.
Is there any sort of dietary restrictions or pre-care that a patient should do before getting an implant?
It's mainly after. So
Okay.
You want to avoid smoking. You want to avoid doing anything that causes negative pressure. So drinking through a straw, for instance. You also want to avoid having anything acidic or spicy.
And how many teeth can you actually put in one implant?
So for each implant, you can put 1 tooth.
Okay, so it's just one. So if you needed multiple, you'd have to do this several different times.
Yes, but you can place 1 or 2 implants and support it by a denture, or what's called a hybrid, that stays fixed in that person's mouth.
And so would that happen you would do them all at the same time?
Correct.
Okay. And how long do implants generally last?
A lifetime.
Okay, so it's not something like you get it done, you need to come back in 5 years. It's once you have this implant, it's good for life.
Once it's done properly, it should last you for the rest of your life.
Thank you, doctor. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on dental fillings and implants. Are there any downsides or complications to having a dental implant?
Patients that have osteoporosis, for instance, are at risk for bone loss. So they do take certain medications that we want them to stop taking before we do the procedure. But other than that, smoking, and, having a good diet.
So what exactly is bone grafting?
So bone grafting is artificial bone that comes in little bone particles, kind of looks like sand.
Okay.
And we use it for people that had a lot of resorption, their bone has been compromised. So it helps reinforce those areas so we can place the implant and it'll be stabilized by that bone.
So when is this necessary? Like what would be what would you see in a patient to even recommend bone grafting?
Usually it's necessary in cases where a patient has been missing tooth for a long time and that bone has been resorbed. Other times it's when they've had an infection and that infection has caused resorption of the bone. Mm-hmm. But in a lot of other cases, we just want to put the bone in to reinforce that implant.
Are there any downsides or complications to having dental implants or bone grafting?
So usually if it's done by a dentist that experienced or a surgeon that places implants, there should be no complications.
And what exactly are the costs between doing like a dental implant or maybe having a bone grafting? Is one more expensive than the other?
Yes, so the implant is more expensive. It's roughly around $2,500 to $3,500.
Okay.
Whereas the bone graft is less. It's about $500 to $750.
Are any of these procedures actually covered by dental insurance?
Nowadays, they are.
Okay. And if someone didn't have dental insurance or maybe all of the procedure wasn't covered under insurance, do you offer other financing options?
Yes, a lot of people do the financing. Mm-hmm. One great option is CareCredit. Mm-hmm. You can pay it over an extended period of time instead of paying it once up front.
And it sounds like this is an investment, especially with a dental implant that, using the CareCredit credit card is going to help you get an implant that's actually going to last a lifetime. So it's an investment.
Exactly.
Before I let you go, I just want to know, what is a favorite part of your job? Like one thing, if you had to pick now.
Really changing people's lives. I had a patient come in and they had a lot of missing teeth. Mm-hmm. They had no confidence smiling. And with our surgeons that do place the implants, we're able to restore them with implants and give them a beautiful smile. And to these days, I meet this person and I get such gratitude from them and it feels so great.
It must feel so amazing, and especially to see all the amazing technology that you have and other dentists have just to use to help people feel more confident and have better smiles.
Yes.
Thank you so much.
Thank you.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.